Parents, for your teenage child's functional neurological disorder, short for FND, you've done therapy, you've seen neurologists times 10, and you've tried hospital programs, special diets, or maybe even medication, and still your teen is stuck. Why is nothing working? If that is what you're thinking about, let's talk about it. Because in this video, I will cover why all your efforts have not helped just yet, and what is missing from traditional treatment, I would air quote it, and what actually moves the needle in your teen's FND recovery. So let's dive in. Hi, my name is Dr. Lee. I'm a pediatric health psychologist and the founder of Teen FND Academy. Let me start by saying this. It is not your fault, and it's certainly not your teen's fault either. So if you or your teen are secretly or overtly blaming yourself for why things are not moving forward, why your teen is still stuck, not getting better, I just want to say most families I work with have already done so much and then some. They have spent months and even years either trying to keep their teen stable or trying to get the answers desperately or just waiting for that neurologist appointment to confirm the diagnosis of FND. So you're not lazy, you're definitely not ignoring anything either. You are exhausted because you care. And I always say that to all the families that I work with. You are exactly where you are because you care about your child's life and health and well-being. And that is not really there because of FND. But here's the truth. The system, and when I say system, it's a traditional system, is not built to resolve FND. And I say this 10,000 times more again, just so that you get that idea, because it's built to monitor, stabilize, refer out, right? So you end up bouncing from specialist to specialist. Well, with this particular part of the body, your child is fine. So it must be 10,000 other parts of your child's body, so go somewhere else. It's a rheumatology, it's a cardiology, it's a neurology, oh, it's a psychology, it's a psychiatry, oh, it's this and it's that, it's all of that, right? And all the while, your teen is still struggling, which by the way, if that is you, please hit the subscribe and then like button so that more people need to know about what your reality is and has been like, especially for your teen who's struggling with FND. So the missing piece is this. It's a full recovery system, which is actually impossible in the current traditional medical system. Not just talk therapy alone, not just medication, not just rest, definitely not just wait and see. Well, we're getting kind of better without doing anything else. So let's just see how it goes. That is not the recovery, just so you know. You're just gambling on your child's life, okay? You need a plan that teaches your teen how to respond to symptoms before, during, and after, each and every time. It is not about preventing or running away from potential triggers. No, it is about teaching your child how to deal with the symptoms before, during, and after. And the plan that also helps your family shift how you help them. So you cannot just continue to ask and check in on your child every single 5 seconds, because that doesn't help. And it's not also the same thing. Well, that means that I shouldn't talk about anything, and that means that we should just leave them alone. Well, not really either. You need a system and plan that builds the real skills that retrain the brain and the body, and that includes the nervous system, both for you and then your teen, because your teen is surrounded by you and the environment matters a lot. So when you change, well, guess what? Your teen is going to change whether they like it or not. Is it going to happen over time, one and done? No. This is about the creating the environment to really build a strong foundation to recover from FND. And that is what most programs and providers do not offer, because guess what? The hospital-based programs and traditional care systems are essentially run by insurance companies. And why do I know that? Because I was in that system, and they don't reimburse for the services that truly helps and works. I was one of those, and I got dinged by hospital administration because I am not getting enough quote unquote revenue or money to the hospital program, because I'm not doing surgery, I am not giving medications, and I am not seeing patient every 15 minutes because it's impossible. And therefore, from the hospital's perspective, the work that I do to actually move the needle and then actually help, and then in turn actually help the hospital's money, because these families don't need to go see an ER visit, right? And they don't need to go back to the neurologist like 10,000 more times. But guess what? Even if that costs the hospitals they also get more money from the insurance companies. So people like me are not necessarily needed, but that's exactly what the family needs to get out of this cycle of FND. So I'm not stopping here, because the worst case scenario is there are a lot of families that I have met who were sort of on the verge, if not on the other side of this thinking. Well, maybe this is just how our life is now. Maybe this is how my teen has to live with, because we were told FND is permanent, chronic, forever. Well, once you have it, there's no cure, so you have to learn to live with it. Kind of like diabetes, whatever the other diagnosis that you might be getting. Well, guess what? That is not true, because I've seen it one too many times to believe, well, you can stay on that side of the island, or you can sail out of the island and then get to the recovery island, which is where I am living in. And your teen over here can get better. And you just need to take a different path of taking the right approach to get to the destination that you actually want for your child and yourself as well. And in my program at Teen FND Academy, I don't believe in waitlists, because waiting means more suffering. And your child has been suffering for long enough, so why more? And in my program, we don't just support, we coach. So this is not another emotional support group, as in like emotional support group is a bad thing. No, it's not. It is a place for some people to benefit, right? But my program is really about, okay, are you ready to roll up your sleeves, so to speak, and then get to the other side of the island of recovery so you can get your life back? But more importantly, you get your child back. If that is you, then you will get in my program a step-by-step system, daily strategies, and an ongoing coaching, and a community of families who are actively recovering from FND. I don't know if I have met any family who told me, oh yeah, we are constantly surrounded by other families like us who are making the active recovery from FND. I've never seen that until I created my program. And this is not a magic. This is not a miracle either. And this is not like a one and done kind of thing. It is a right approach at the right time. So if you're watching this and thinking, gosh, we've tried anything and everything, I want you to know you have not tried this just yet. And this is not the same. It is different. And it is built for result, not just coping. And it has helped hundreds of teens get their life back beyond FND. You want to learn more about it? Well, click the link below and you can learn more about it. Otherwise, keep watching these videos, because the more knowledge you have, more power to you. You're not going to lose anything. So have fun, but I am here for you when you need me. Thank you so much for watching this video, and I will see you in the next video.